My name's Caroline, I'm a physical therapy student, and today I'm going to teach you all about the knee joint. So the bones that comprise this joint include the femur, tibia, and fibula, and not shown in my picture is the patella or your kneecap. And then we also have our quadriceps or knee extensors, which are going to insert onto the patellar tendon to the tibial tuberosity. So now let's break down the different ligaments. So I'm sure you all have heard of the ACL, and that is our anterior cruciate ligament. It spans from the anterior tibia to the intercondylar fossa of the femur and prevents anterior dislocation of the tibia. Behind that, we have our PCL, or posterior cruciate ligament. This spans from the posterior tibia to the anteromedial femoral condyle, and this ligament prevents posterior dislocation of the tibia on the femur. Next, we'll look at the MCL, or the medial collateral ligament. This ligament goes from the medial epicondyle of the femur to the medial condyle of the tibia, and it protects against valgus stress. Valgus stress is basically a force that is coming in laterally. Its partner, as I like to call it, is the LCL, or lateral collateral ligament. This goes from the lateral epicondyle of the femur to the fibular head, and this ligament protects against varus stress, which is basically forces coming medially, so opposite of valgus stress. Okay, next we have the menisci. So we have the lateral meniscus and the medial meniscus. They both function as shock absorbers and stabilizers. The lateral meniscus is shaped like an O or a circle, and it's a little bit more mobile. And the medial meniscus is shaped more like a C, and it is less mobile. It's hard to see from this view of the picture that I've drawn, but if you look up other cross sections online, you can better visualize that. And there you have it. That is a brief overview of the knee joint.